Common symptoms of mold toxicity. Hi, I'm Megan. I'm a nutritional therapy practitioner and functional blood chemistry specialist, and mold can be really sneaky in the body and show up really differently for a lot of people, and it's often missed even in the holistic health space and leads to a lot of chronic issues. So here are some big red flags that we use in our practice that would indicate that we probably want to do a deeper dive into mold, maybe do some testing here because this is likely going to be a bigger root cause. So the first one is histamine related symptoms, and this could be like chronic allergy issues, sinus pressure, sinus headaches, postnasal drip, feeling like there's always mucus kind of in your throat, always having to clear your throat, having like little balls of mucus always in your throat, histamine like rashes, hives, itching. If you've ever gotten that like internal, like it's almost like itching, you want to itch from the inside out, that is really, really commonly mold here. Chronic gut issues and chronic gut infections that maybe you've done some protocols here and basically like nothing you do lasts long term. Often there's a bigger root cause, and that's just contributing to these chronic gut infections that no matter how much you address the gut, it's not going to resolve these things until you look at the bigger picture. Hormone imbalances. Hormones are another really big one, and hormones, this could be cortisol, sex hormones, and or thyroid hormones. Oftentimes it's all three when we're dealing with mold here. Significant cognitive issues like really big changes in cognition with brain fog, trouble concentrating, especially trouble remembering and trouble recalling. Like really significant changes in your health and in your brain health doing this. Significant mental health struggles. Now, obviously this can be from a lot of factors, but mold really impacts our neurotransmitters and neurotransmitter pathways, which means we'll often see when we test for mold using an organic acids test, like significant reduction in serotonin, dopamine, epinephrine, and neuroepinephrine, which is just going to drive depression and or anxiety. And then we'll also see, if we look at some blood work, like blood sugar dysregulations, like some weird markers going on with like fasting glucose, insulin, C-peptide, LDH, HbA1c, like some of these blood sugar markers, despite not really having a real reason, like a metabolic, a nutritional type reason for these things. Same thing with cholesterol. We'll often see some weird patterns. Now this could be across the board high, across the board lower, or just like some weird patterns of like one or two markers are in a pretty good range, one or two markers are not such in a good range, and despite lifestyle changes, even sometimes despite medication, like we're not seeing those markers change a whole lot. So these will all signify we probably want to test for mold. Certainly we can look at blood work that will give us some indications here. Kind of our go-to test is an organic acids test. That's going to give us really deep insight into mold, neurotransmitters, nutrient deficiencies, the gut, yeast, fungus, and bacteria, among many other things. If you feel like you are struggling with mold or these just chronic health issues that you cannot explain, we specialize this in our practice, and we do free consults. So book your free 30-minute consult. There's a link in our bio. We'd love to chat and help you start healing.